More than 15,000 New Yorkers with intellectual and developmental disabilities, or IDD, struggle to get access to comprehensive dental care. That, according to a 2021 survey by the state's Office for People with Developmental Disabilities Task Force on Special Dentistry. They can end up, these people, on wait lists of a year or even more to get basic dental care. So an innovative fellowship is now aiming to change this problem. Joining me on this Wellness Monday to talk about this is Jonathan Tayan. He is president of the nonprofit New York State's Academic Dental Center. So first of all, thanks for coming in to talk about this issue.
Thanks for having me.
And so tell us a little bit about the perceived problem or the actual problem, and what you are trying to do to change it.
So the real problem is that so many people with intellectual and developmental disabilities, or IDD, have real access issues where they have really been, to a large extent, left out of the conversation about how we allocate our healthcare spending dollars. And because of this, because there isn't enough funding to support their oral health care, as you mentioned, they can wait for more than a year to get access to comprehensive care. And really what that does is that makes their conditions get worse. And so it really is an inhumane condition. And we're really trying to address this both through policy measures and also through this program that we started this past year.
So tell us a little bit about the program, how the state is helping, and what additional help that you do need.
Sure. So this is a fellowship program that we started last year. We piloted it with some grant funding from the Mother Cabrini Health Foundation. We have two fellows, two amazing recent dental graduates, one at NYU, one at the Touro College of Dental Medicine up in Westchester. They're amazing, amazing dentists. They're spending a year really learning intensively how to provide advanced care for people with IDD. And we are now expanding this. So there are 6 dental schools across the state. We have gotten funding from New York State to actually expand to 6 fellows this year. So we're placing 1 fellow at each of the dental schools.
Put that in context for us, though. 2 going to 6 fellows versus how many people need that treatment. And I mean, it seems like that doesn't measure up.
Yeah. The need is huge. There's no question. One of the issues, though, is that there's so few training opportunities for people who really do want to specialize in special needs dentistry. So we are looking, this is one of the only, in fact, the only state-funded fellowship like this I'm aware of in the U.S. And really we want to grow the community of providers who really focus on special care dentistry over time. And so one of the things the fellows are doing, in addition to practicing, they're also teaching and doing research. And so we really want to make sure that they are communicating, providing some direction to current dental students to pursue this as at least part of their practice to treat people with IDD.
Right, at least that is a first step. Jonathan Tayan, thank you so much for coming by and speaking with us about this.
Thanks so much for having me.
And for those who would like to get more information, because as you said, like, the communication is one of the biggest parts, you can go to nysadc.org to find much more. Thanks again for coming in. We appreciate it.